How are you, Jenna?
Good. How are you?
Good.
Right.
Good afternoon, everyone. Thank you all for joining us today for another Cuyahoga County and Cuyahoga County Board of Health COVID-19 media briefing. My name is Miranda Corton, and today we are joined by County Executive Armand Budish, Board of Health Commissioner Terry Allen, Assistant Professor for the Center for Community Health Integration and Director of Preventative Medicine Residency at Case Western Reserve University School of Medicine, Dr. Johnny Rose, and Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush. Before we begin, just a reminder to any media who have joined by phone to please keep your phones muted until after all our speakers have presented. And once the briefing is over, we will then open it up for questions. We will start today with County Executive Armand Budish. Please go ahead, Armand. Thank you.
Thank you. Good afternoon, everyone. I usually start these off by expressing my gratitude to our County Board of Health and the work they're doing to keep us safe and informed. I continue to be grateful, extremely grateful, and very proud of the work that Director Terry Allen and his team are doing day after day. And speaking of gratitude, this is the first briefing that we've had since the election. I want to thank the people at the Board of Elections and all the good folks who worked at the polls for their great job. Despite a huge turnout, our election went very well, very smooth. Now for some not so good news. I am very worried about the direction of this pandemic in Cuyahoga County. As you're going to hear in a few moments, the situation here, as we've been repeatedly warned, is now on the verge of spiraling out of control. And this is after months and months of constant work from our Board of Health and our hospital systems. They've worked to push out testing, to trace contacts, and to issue quarantine orders to care for the sick and those that are dying. Our health system is nearing crisis, and the individuals who are on the front lines are exhausted. I know we're all tired, but the virus doesn't really care how tired we are or how hard this is. It just wants to keep spreading, and it's spreading fast, very fast. Since the pandemic began about 9 months ago, I've had periodic conversations with our healthcare and hospital leaders. They've always reassured me that they had everything under control. For a period, they had to stop doing non-essential surgeries and procedures in order to ensure their ability to handle COVID cases. And that cost them financially. But our healthcare systems are world-class and with tremendous capacity. And I never got the sense that they were really concerned about their ability to serve all those who were ill, until now. This is the first time I've really gotten the impression that they're worried. You know that our health systems are competitors, friendly competitors, but still competitors. I've been told that they've now come together in an unprecedented way to coordinate the care of COVID patients and to share resources that are necessary to care for the people of Cuyahoga County. Now, what does that tell you? Their personnel, doctors, nurses, lab techs, everyone, they're tired. Long, stressful hours for months on end took its toll. And just when they could use a rest, here comes the worst surge yet. Now, don't get me wrong, they are great. And they're serving all the COVID patients, but they're stretched and they're stressed. Just think what happens if 5% or 10% of personnel themselves catch COVID or come in contact with someone with COVID and are required to quarantine. Then what? Right now, without a vaccine, there are two primary ways to slow or stop the surge. One is shutting everything down. No one wants to do that. No one. The other is for all of you to take the precautions we all know about. All of us. This is about character. Our character as a people. It's been said many times that we're a people with grit and determination. We've certainly been through tough times before, and we've always pulled together and made it through even stronger and better than before. How we react in times of crisis can define who we are now and in the future. It certainly defines how many of our friends, neighbors, and family are either going to die or suffer some of the long-term effects of COVID that we're seeing now. Part of the reason for the recent surge is that we've let down. Yeah, we wear a mask, but wearing a mask that doesn't cover your nose, that doesn't cut it. Talking to someone inches away, even with a mask, that doesn't cut it. Wearing the same mask every day without washing it doesn't cut it. Going to a restaurant where the server wipes down your table with the same towel he's wiped down 10 other tables, that doesn't cut it. And now we're coming to Thanksgiving. Having your parents, kids, cousins, and siblings over, that doesn't cut it. I know this is hard. It's terrible. But we have to stop this surge. If we don't, there's a real risk that our healthcare providers won't be able to properly care for the people who need help. That could be you, your parents, or your children. Here's how we can win out over this virus. Don't gather in large groups. Stay home if you feel sick. Stay home if you don't have to go out. Limit, and I mean really limit, indoor get-togethers. If you run a business, encourage any employees who can work from home to do that. Limit your trips to the store. If you do go out, use our mask compliance map, which is at cuyahogacounty.us/masks. Make sure you only go to places complying with best safety practices, and fill out a report on the web about what you observe so we can constantly update the map. When you're around other people, stay 6 feet apart. Wash your hands, get your flu shot, and of course, wear a mask. We in county government are doing our part. I'm updating, revising, and supplementing my executive orders. I'm extending the fiscal emergency order to June 30th, 2021. We'll keep our buildings open for now so the public can get services they need. But anyone entering our buildings must be screened, wear a mask, and socially distance. Masks must be worn properly, covering the mouth, chin, and nose. And the administration's public meetings must be conducted remotely. By now, you know what you have to do yourselves. We've all heard it again and again. But hearing and doing are two different things. We have to stay the course. We have to double down. To quote Harriet Beecher Stowe, when you get into a tight place and everything goes against you, never give up. For that's just the place and time that the tide will turn. So I'm asking each of you to think of a time when you thought you couldn't succeed, when it seemed as if everything was going against you, when you thought you were just too tired to go on. But you persevered. You pulled yourself together. You thought about the goal you had set for yourself or the change that you wanted to see. And you dug deep into your strengths and your will, and you kept at it. You kept at it until you reached your goal. That's what we must all do now. Every choice you make right now has got to be about getting this virus back under control. We have to take control of this virus before it's too late. Thank you.
Thank you, Executive Budish. Armin, I think you've been such a champion of public health from the beginning of this pandemic, and I'm very grateful for that. I think you've earned an honorary Master of Public Health degree in your public education messages, so thank you very much for that commitment and for being so passionate in sharing that message. It's really important to us, and we appreciate your support. As mentioned, we're fortunate to be joined by Dr. Johnny Rose from Case Western's Center for Community Health Integration. He also runs their preventive medicine residency program there. And Johnny was the first preventive medicine resident some 10 years ago to come from that program and worked here at the County Health Department. He'll be followed by Jana Rush, our Director of Epidemiology, Surveillance, and Informatics. So yesterday, Governor DeWine announced that 68 of Ohio's 88 counties are now red in its state's public health advisory system, indicating a high degree of spread, with Tuscarawas and Franklin now on the watch list for purple. As we watched the governor's statewide address on Wednesday night and listened to his briefing yesterday and listened to Executive Budish just moments ago, it should be clear to all of us here that this is very serious business. Here in Cuyahoga County, we are now on a very slippery slope. Yesterday, our call center surpassed 23,000 calls from the public since the beginning of this pandemic. Call center volume has more than tripled over the last week, with staff taking almost 300 calls from the public just yesterday. We also continue to see stark inequities in the African American population, which is now 2 times more likely to be diagnosed with COVID and 3.5 times more likely to be hospitalized, more likely than their white counterparts to also unfortunately die from this virus. Our COVID testing positivity rate in the county has continued to rapidly rise. This is very concerning, and you'll hear more about that from Director Rush, because it indicates basically what the burden of disease is and how many people we're aware of that are potentially out there positive and part of the transmission cycle in the community. So it's very concerning as these positivity rates continue to rise, not just in Cuyahoga County, but across the entire state. Our co-director of prevention and wellness, Ramona Brazil, wanted me to share some important information about case investigation and contact tracing with all of you, as our case counts have also significantly increased. So in response to this surge that we're seeing this past week, in recent weeks it's been increasing, the Cuyahoga County Board of Health staff are moving out of some other programs and in to assist with COVID-19 response. We've added additional shifts in our for evening shifts in our response to our 7-day operation. And this week was the first time that we exceeded more than 300 and then 400 cases reported in one day. And today was the first day that we received more than 500 cases in a single day, just in our health jurisdiction. Since November 1st, we received more than 3,900 cases reported of COVID-19 and more than 3,200 close contacts. The reported cases are but a fraction of those who are currently infected in the community. And so the actual number is much higher, because this only is the fraction of people that are reported and are tested and confirmed. We are now modifying our processes internally, given the surge, to keep up with cases as best as possible. Based on our capacity, we may not be able to reach out to all contacts. We're asking people diagnosed with COVID to help us by informing their close contacts. This would include anyone in contact within 6 feet of someone for 15 minutes or more. That would be in contact with someone 48 hours before their symptoms started, or from the test date from someone without symptoms. If you're notified that you've been in close contact with someone diagnosed with COVID, you should quarantine for 14 days from the last date of contact with that person. If cases continue to increase, we will need to modify our case investigation process. We may need to triage and contact cases based on the seriousness of the illness, the fatality risk, and the potential to lead to large exposures or clusters. On the exposure front, we continue to see a large number of social gatherings in the community. Executive Budish talked about this as a major risk factor. We're asking those who work in sensitive occupations such as long-term care facilities, schools, healthcare, and other group settings to be particularly vigilant because of the risk to bring COVID into those high-risk settings. We're also asking assistance from parents to not have gatherings outside of the school setting. Gathering outside of the school setting exposes children to COVID, and then those children are attending school. Our schools have done a great job in implementing their plans, but these get-togethers, such as birthday parties and sleepovers, are threatening their ability to limit spread among students. These updates are very important because the tide is clearly rising. The exponential increase in community cases inevitably leads to more hospitalized patients. Our hospital partners are also reporting the impact of the surging virus, with systems electing to postpone elective surgeries. Inpatient and outpatient numbers are increasing. Emergency departments are seeing increased volumes. Hospital beds are filling up, and ICUs are also seeing an increase in patients. And sadly, this trend has also led to an increase in deaths from the virus. Over the last 2 weeks, 50 people have died from COVID in our health jurisdiction alone. 50 people, with 3 to 4 new deaths being reported every day. In stark comparison, during last flu season, we had 39 people die. The mounting loss from COVID-19 is a huge burden. They were mothers, fathers, sisters, brothers, grandparents, friends, and neighbors who've fallen victim to this virus. Among the living, they leave an indelible wake of tears in their passing. It's a myth that only older people get seriously sick from COVID. Symptoms can be severe, no matter how old you are. Hospitals and local health departments around the country know too well that this is true. Every day, we talk to people of all ages in the community who are suffering from this virus. Just Wednesday, on Veterans Day, I personally spoke with 3 people that I talked to in their hospital beds on supportive oxygen with their spouses, distressed at their side. We have an obligation in our community to recommit to prevention today, to save as much heartbreak as we can going forward. If you drive on the ice and you slam on the brakes, you know your car won't just stop. It'll keep sliding on for some time before it finally slows down. And so it is with this virus. The steps that we take today will not halt the virus in its path immediately. It will take time to slow it down, just as it did in the spring and summer during the last 2 surges. It will take all of us to turn the tide. To that end, the governor stated that the Ohio Department of Health will require all stores to post a sign at their entrances alerting customers to Ohio's mask mandate. And if the current trends continue and cases keep increasing, they will be forced to close restaurants, bars, and fitness centers. And as county executive said, no one wants to do that. This strategy is being employed to slow the virus in a number of states because the surge is happening everywhere. We need to do everything we can to limit the havoc from this virus by staying true to what works. Back in August and September, our high degree of local mask use in public spaces and private, following physical distancing guidance, avoiding gatherings, implementing remote work options, and promoting hand hygiene, staying home when sick, all worked to keep our case numbers down. We can't let our guard down in cold and flu season, not now. We may feel comfortable among friends and let our guard down. This virus will take advantage of us if we do. People are wearing masks in grocery stores and workplaces and taking them off in private residences and social gatherings. We're seeing people expanding their social circles and gatherings in groups indoors. Maintaining small bubbles, social bubbles, is good prevention, particularly at times like this, and we know it works to reduce spread. This increase in social mixing without masks here in the fall in flu season as people begin to move inside, can have a dramatic impact on our trajectory going forward. And let's remember the basics. People should self-monitor for symptoms of COVID-19 and get tested if you develop symptoms. If you've been in contact with someone that has recently tested positive for COVID-19 or someone with COVID-19 symptoms, stay home for 14 days after your last contact with that person and monitor yourself for symptoms. That's a way to help to be part of the solution and stop the chain of transmission. If you tested for COVID-19 during the quarantine period and you tested negative, you still need to remain home for that 14-day period as symptoms may still develop. If you're diagnosed with COVID-19, remain in isolation for 10 days after symptoms start and resolution of fever for at least 24 hours without the use of fever-reducing medications and with improvement of other symptoms. We know that there's also an increased risk of severe illness from COVID-19 among older adults and those who have chronic illnesses like asthma or diabetes, those who have overweight or obesity, and those who smoke or have a history of smoking. We should avoid direct contact with anyone who is considered high risk to help protect them from us. High-risk individuals should take extra care to follow precautions. And stores should consider offering hours available for senior-only shopping to reduce risks to those folks. And please remember to get your annual flu shot. You can find a location at vaccinefinder.org. Limit those in-person actions with others and avoid gatherings of any number. It would be best to postpone gatherings like weddings and receptions or parties with extended groups of family and friends. This will help to prevent transmission of the virus during the holidays. For schools that are providing hybrid or in-person education or holding extracurricular activities or sporting events, paying special attention to safety precautions is essential. Students should not gather in groups outside of school settings and school activities. And I'm going to pick up my son a week from Saturday from college, and I'll be wearing a mask the whole way home, and so will he. Consider working remotely where you have the option to do so, and follow the good hygiene standards of cleaning surfaces in your hands. And using hand sanitizer frequently, avoid touching your face, covering your cough, and coughing into a tissue or your elbow are all good practices. This vigilance is our way out of the pandemic as we wait for a vaccine. So I saw on social media today a post from a physician in Wisconsin who's been caring for COVID patients throughout the pandemic. She was tired. She said that when patients in distress come to the hospital, their families ask her to do everything they can to save them. She shared her commitment as a doctor to do all she could to help her patients. She then in turn asked her community to do all they can to prevent people from getting COVID in the first place and potentially ending up in the hospital. That's the least all of us can do. It's our shared responsibility to our community. I said that this virus does not have a conscience. It doesn't get tired of infecting us, and left to its own devices, it won't stop until most of us are exposed or vaccinated, period. But we have the power to snuff it out by following the prevention steps that have worked so well in August and September. Masks on, keep your distance, avoid gatherings, and stay home when sick. This is how we fight back together. For all my coworkers here at the Cuyahoga County Board of Health and all the public health workers across Ohio, I thank you for all you've given and wish you the strength to continue to soldier on, because our communities are counting on us. After all, public health interventions are what stand in the way of this virus. Before I end, we need to recognize that there is a gleam. Even as we face the prospect of a very difficult winter, there is a gleam. We have heard several positive reports about the effectiveness of COVID vaccines that are moving through the clinical trials and approval process. This light at the end of the tunnel is our motivation to do all we can now in the coming weeks and months to stem the tide of this virus. It will be hard, but it can be done. Thank you for your time and attention. And now I'll turn it over to Dr. Rose.
Thanks, Commissioner Allen.
Today I'm going to share with you some results of computer modeling that has taken place with a collaborative of researchers and mathematicians from Case Western Reserve University and University of Akron. A couple things are distinct about this model. First of all, it can account for the effect of asymptomatic transmission of the virus, which, as you know, is a major part of how this virus spreads. And second, it can account for the effect on spread of people isolating once they know they have the virus. Okay, so because this model is based on parameters that are updated every day based on new data that we're getting about cases, it can also be used to follow sort of the what's called the reproduction number of the virus. Okay, this is like R naught, the basic reproduction number, except R naught is just what we would assume if nobody was infected in the population. We can no longer assume that. So that's why you may hear less about R naught these days as opposed to just reproduction number. So the first graph I want to show, if you want to go ahead and put that up, this is a trajectory of our reproduction number since the very beginning of the pandemic. And so if you'll recall, just like with R naught, this number needs to be over 1.0 for the epidemic to really take off and continue to spread. And so early on, we were really high, way up above 2. And then we came down pretty rapidly as mitigation measures went into place. You'll all remember that we popped up in July as well, and then things sort of cooled down in August and September. But since the beginning of October, we've really been on the rise again, which is we're seeing in our case numbers today. So we can also use this model to make projections, and I'll show you some of those projections here shortly. Like projecting the weather, the farther you are out in time, the more difficult it becomes to make projections about the future. Unlike the weather, we can change that future with our actions, okay? So this model works on the assumption that people continue to behave in the way that they've been behaving in recent days and weeks. So let's go ahead and show the projections for this goes through almost the end of November, through November 29th. And I'll say just a word about this model. It's been quite accurate so far. It has never overestimated the number of cases in this 3-week time span. And it's been within these lighter bands more than 4 out of 5 times. So we have increasing confidence in what this model tells us. So what we're seeing now is in the next 3 weeks, we are expecting to keep climbing at an increasing rate, and by roughly this time next week, at the trajectory we're on, we expect to see 1,000 cases a day in Cuyahoga County. And then at the end of the month, we expect to be seeing over 2,000 cases a day if that trajectory doesn't change. And obviously this is not a sustainable level of cases. No healthcare system in the world can absorb this. So clearly something needs to change about our behavior. And you can see that the growth rate, as the number of cases go up, the growth is faster. And this is the definition of exponential growth. And so that's where we are. So how effective is it to change our behavior? If you show the next slide, it's the most important thing. This is the same chart that I showed you with basic reproduction number. And the biggest change that we had in basic reproduction number was when we had the initial stay-at-home order back in the early spring. And no one wants this to happen again, but it just shows you how reducing social contact has such a dramatic effect on this. This is, this is really where the rubber meets the road when it comes to preventing this. And then, as you can see, as things have gotten a bit laxer, the R0 has continued to go up again. If you look at the next slide, as another demonstration of how much our actions can change the outcomes, this is what the same model projected would have happened had we not undertaken any mitigation measures back in the spring. So had we not all started staying at home, wearing masks, changing the way we work and live. And if you notice the scale here, this is exponential growth. So, we're talking 10,000 cases per day had we not taken any action back then. So you can see how with this exponential growth, it can get out of hand so very quickly. So it's really going to be incumbent if we're going to change the course of this that we saw on those projections, getting up over 2,000 cases by the end of the month. The public's behavior is going to have to change. How do we do this? It's simple, but it's not easy. These are all the things that we already know how to do. It's wearing masks, it's social distancing, it's avoiding crowds. And that is the only way that we're going to bend this curve in any significant way. We're way too far off from any sort of widely available vaccine to have any effect on this. So this is going to be up to us and the way we behaved to change this. So with that, I think we're on to Director Rush.
Epidemiology for the Board of Health. So if we can pull that up, I can begin to go through the information. Okay, so for the first section, so currently in Cuyahoga County jurisdiction, we have 16,736 cases have been reported to date for our jurisdiction. During the first few weeks of November, we were averaging about 315 cases per day to date, but that number has doubled in comparison to last month. We were averaging nearly 100 cases per day. And as has been stated before, we have hit our highest number of cases reported in a single day since this pandemic began, and that's over 500 cases reported in a single day. And each week, the average number of cases reported each day accelerates. So that's happening faster and faster as we move through each day this month. So for our deaths, we had 28 new deaths reported over this past week. This is the highest number as well that we have seen since in a single week since the beginning of the pandemic. And overall, the percentage of our deaths have remained stable over the past month at about approximately 4%. So for our hospitalizations, we have seen an increase in our number of hospitalizations over the past month at approximately 2% increase. We went from 8.8% hospitalization rate to 10.8%. And we've also seen that increase as well with our ICU admissions, and that has also increased slightly over what we saw last month. Next section. So for our case demographics, so these numbers have remained pretty stable over the past month, but what I would like to pay close attention to is the number of people with pre-existing conditions. That number of people has increased quite a bit. We went from 34% last month to just this week, 45%. So that's over 10% increase in the number of people who have a pre-existing condition that have been diagnosed with COVID-19. All other demographics are similar to what we saw last month. As I stated, the 20 to 29-year-old age group is the highest number of cases that we've seen, and we have a larger proportion of cases among women. So we can go to the next section. So our epi curve, as you can see, we had a huge spike in July. That is where we had our largest number of cases being reported, and now we're seeing that second spike or wave start to happen, and it has definitely exceeded what we were seeing in July. We have surpassed that more than twofold. Next section. So for our map of our cases, this data has also remained pretty stable as far as the distribution of our cases, particularly among those that have a higher frequency of cases. So those dark shaded areas on the map shows where we have a higher frequency of cases in that particular zip code, and that's pretty much remained stable over the past month. Next section. So for hospital utilization, so the major change here with this graph is our adult critical care bed capacity or utilization that has decreased from 84% to 82% this week. Next section. So for our hospital testing data, so for Cuyahoga County hospitals, our testing positivity rate was 14.9% for the week ending of November 7th. That's an all-time high compared to where we were from the previous week ending October 31st at 9.3%. So definitely a significant increase in the number of people testing positive for COVID-19. And also our nursing home positivity rate is increasing. We went from 5.8% last week to 7.1%. So in ending or conclusion, we are seeing the largest surge of cases and deaths reported since the beginning of our response efforts, and our transmission is occurring rapidly throughout Cuyahoga County. So we are just definitely urging everyone within the community to do their part to help limit the spread of this virus in our community. And finally, or lastly, I want to give a huge thank you to our data team here at CCBH. They make this data brief possible every single week. And so they work a lot of hours and put in a lot of time to crunch the numbers and the data. So I want to give a huge thank you to that team. And I will turn it back over to Commissioner Allen for further remarks or questions. Thank you.
Okay, thank you, Jenna. So yes, we will now open it up for any questions. Any media with questions, please go ahead and unmute yourself, state your name, and go ahead with your question, please. Thank you. Okay, if there are no questions, that will...
Miranda?
Yeah.
Miranda, just cut up from the YouTube video. Excuse me, I had a question. This is Courtney with Cleveland.com and the Plain Dealer. I had a couple questions for Terry and Armand. I'm wondering, you guys talked extensively about how folks need to really, socially distance, stay home, all those kinds of things. Can you speak to Thanksgiving? Should Cuyahoga Countyans not gather with people outside their household for Thanksgiving? Is that your recommendation to the county?
That is our recommendation in public health, Courtney, yes, that people not gather with people outside their household. They can connect through Zoom. They can put it off until a better time, but we see that as a risk. You can deliver food to your loved ones if you're the cook. You can take some food next door to your neighbor if they're on their own. Things that you do to be good neighbors. We think that would be the best policy at this time.
And, a lot of people have extended families, big families, and that's dangerous. It's real dangerous. If you keep it to self and spouse, maybe a child that's living with you, hopefully that'll be okay. But when you start talking about extended families, close friends, start to get numbers, it's dangerous. And the public health people are saying, don't do that. And
just to assure we're practicing what we preach, the biggest public health advocate for that is my mom, who's, she's the one who loves to have family around, 30 of us or more in the room. And she's the one leading the charge saying, we're not doing it this year as hard as it is. So I think that's the best policy. There'll be time for us to celebrate when this is over. And it'll be a great celebration when that time comes. But now is the time for all of us to be part of the public health solution.
Also, lots of people plan to travel around the Thanksgiving holiday. This is not the year to do that.
Thank you. And I was hoping to ask a second one too. The modeling that Johnny Rose presented seems pretty shocking. And Jana Rush was talking about the increase in hospital utilization rates. Is there anything that can be done on the county level? We haven't seen a stay-at-home order come out from the state this time around, and that, based on the modeling, that really led to a huge drop before. Is there anything that can be done by you guys on the county level to mimic that or achieve those kinds of results here if we're not seeing it at the state level?
Well, my first thought is right now, the governor has made it clear that he plans on making some interventions here if we keep moving in the wrong direction that would result in reducing risk. I think we are already part of that system. As I said, we're getting 300 calls a day and responding to complaints and dealing with issues in businesses and addressing those matters, working with the Ohio Investigative Unit, referring people that in bars and other places that are not complying. And as you know, they can potentially lose their liquor license if they're not complying with the rules. So from our standpoint, we plan on waiting with the governor as that is implemented from a public health workforce standpoint across the state. We're all going to be part of that system. It is nothing that anybody wants to happen. Everybody knows that these shutdowns, there's a huge price to pay. There's a huge price to pay for that sort of decision. At this point, we're going to be waiting to see what happens in the next week. We are very concerned with Dr. Rose's predictions. We're very concerned about what that could mean. And what we were, I think, trying to put forward is that there are things we can do right now, today, this week, changes that can change those trajectories. There's nothing more that any of us want than for Dr. Rose to come back in a few weeks and say that we didn't hit those numbers. And that would only happen because of the changes in behaviors and decisions that each of us make. And so I think right now, really, we're talking about just a few days away where some big decisions could be made based on our trajectory at the state level that would be common across all of Ohio. And then we'd be in a position to work to assure that those orders are carried out if they're necessary.
Thank you. And hopefully just one more, I don't know who will answer this, perhaps Dr. Rose. Based on that modeling and what you folks at the Board of Health are seeing with hospital utilization rates and capacity here in Cuyahoga, do you have any sort of sense of when we might hit a breaking point with hospitals here? Do any numbers kind of speak to that on your guys' end?
It's hard to say when. Some of the patterns are changing. For instance, providers are getting better at managing this. So it seems like fewer people are going to intensive care, which helps. A lot of it depends on how healthy the staff stays. But what I think few would dispute that if we hit a level of 2,400 cases by the end of the month, it's going to be a tremendous challenge to prevent bad outcomes from happening. because of that shortage.
It's my understanding we have a huge bed capacity in this county. We're very fortunate. The big risk is, as Dr. Rose just stated, from what I'm hearing from the healthcare leaders, is personnel. They're tired, they're stretched, they're strained, they're stressed. And if they get sick, if they can't work, that's where the breaking point comes.
I would expect too that we would continue to hear on a weekly basis, if not more frequently, feedback as our zone hospital leaders across the state are interacting and sharing their experiences and what they're learning from all the hospitals in the zones. And so that would also help us to track the very information that you mentioned, Courtney, to understand the trajectory. Are there a lot of people that are quarantined and isolated because they're sick and they've been exposed and they're symptomatic, for instance, and those pressures along with just overall patient load. So we're going to continue to watch those numbers. And as Armin said, we are very fortunate. We have a great capacity in our community, but we also know that those hospitals are connected to satellite hospitals in other counties. And as people may have health issues, they could be transferred into Cuyahoga County for care as need be. So that also can influence our numbers here as well.
Thank you.
Hey there, it's Amanda Van Allen from News 5. I was just wondering if Terry Allen could give me an explanation for something. You talked about the number of African Americans. I think it's 2 times more likely to be diagnosed. Is that just in Cuyahoga County, or is that nationwide numbers?
Well, I would say that those numbers that I reported are our specific numbers, but certainly nationally, it's been well reported that there are health disparities. And this, as it relates to COVID, we know that if we look at a whole range of chronic diseases, asthma, heart disease, late stage cancer diagnosis, which can lead to higher rates of fatalities. And as Armin has described, as Executive Budish has described in his work around the declaration of racism as a public health crisis, the recognition is that these health effects that these health effects are profound and are disproportionately and inequitably skewed toward affecting minority populations in our community. And so this is not a new issue. This is basically insult to injury as we look at the results of COVID and the impact on the African American population. So this is seen in many communities around the country, and particularly in urban areas throughout the country.
The disparity in the impacts of COVID is one of the big reasons why this is the time where we adopted the racism is a public health crisis. We saw the disparities. It's awful, and we have to deal with it. It's not just us, though. This is happening all over. I talk to my colleagues around the state, around the country. We're all dealing with the same thing.
Thank you all. Are there any other questions?
Ryan Schmelz with Spectrum here. We hear a lot from folks who say, hey, we've been under a mask mandate for several months now in a lot of places across Ohio. And also, businesses have been under an alcohol curfew for quite some time now as well. And other businesses are also facing certain restrictions too. And is it fair for folks to question the effectiveness? Because we hear that a lot.
So, Ryan, you're saying the effectiveness of masks. Is that what you're asking?
People just question. A lot of times tell us that they sometimes question, the restrictions that are put on business and, the overall mask wearing as well, because we've been doing all these things and a lot of it's been mandated by law for some time now, but we're still seeing this massive surge. Is it fair for them to question that?
Well, I would start off, and certainly others may have some thoughts. I would start off by saying that, we saw a huge drop in cases after the mask mandate in the summer. We had the big surge in the summer, and the drop is obvious. It was statewide, and it was well documented. And I think what we had was a lot of fidelity to that mandate. People understood what was happening and began to adopt it. What we've seen, I think, really since September and into October is a backslide. People got tired. They were starving for social interaction, and they've slipped when, they're at home in a private residence. They have this sense of comfort and coming together. And in the middle of cold and flu season now, where risks are then already elevated overall for viral transmission. So we have, this confluence of issues with slippage around wearing masks in private social settings, and still people gathering because of this desire for social interaction. All these come together, I think, to influence the numbers and where we're at today. But I think if you can take steps to reduce having smaller groups, and then of course the desire is to avoid any closures. Nobody wants to do that. I think overall we're very concerned about that, but I think there is the governor feels some sense of obligation and responsibility that if the numbers continue to rise, we want to avoid the sort of numbers that Dr. Rose described. And the only way to do that is to intervene, and we just hope that does not come to pass.
People are getting lax. Everybody's tired. That's just a fact. But I've seen it on Spectrum. I've seen it on WEWS. I've seen it on all this. You see the pictures. People often don't wear masks, and even when they do, you see them wear a mask like this. The nose is completely exposed. That's not wearing a mask. That is not helpful. You got to cover the mouth and the nose. You got to wear it right, or else you're still exposing yourself and others.
Yeah, I would just add, there were some questions at the beginning of the pandemic about the effectiveness of masks for this particular virus. But I mean, the science is in, and it's not iffy. Masks are very effective. They don't not only protect people around you, but they can also protect the wearer if they're worn properly. So it's if we're not anywhere close to a point where we have 100% mask compliance, so there's the orders and then there's the reality, and unfortunately the two aren't matching.
Thank you. Are there any other questions? Okay, I think that it concludes our briefing for today. So thank you all again for joining us. Please stay safe and have a good weekend.
Thank you. Thank you.
Thank you.
Thank you.